There are three main areas where we can create efficiencies and help direct resources to better management of chronically ill patients within current healthcare infrastructure. The first category is waste removal. The biggest waste that comes in healthcare today is because of duplication of effort. For example, a patient goes to one healthcare system with a condition, he gets a certain set of exams, and a few months later, the same patient may show up in another healthcare system and would be repeating the same set of exams. Now, more often than not, the clinical value of repeating those exams may not be very high, but we have duplicated those exams and created a huge waste in the system. And this amount of waste, if can be avoided, can free up a lot of resources. And there are technologies available like vendor neutral archives, which ensure interoperability and transfer of data from one institution to another. So, if healthcare systems can adopt such technologies and agree on providing and making patient data available, this can help us reduce waste and free up resources, which can be then provided to better care for chronically ill patients. The second area with great potential for improvement and savings to provide is for the more timely diagnosis to every patient, or I would say to every prospective patient. The most of the money in healthcare actually gets spent onto the patients which got diagnosed late, and typically they are terminally ill by the time the proper diagnosis was received. So we end up providing expensive therapies to those patients without necessarily better outcomes coming through. So if we work together with governments in order to provide infrastructure which can have better screening programs and awareness programs, especially in the area of oncology, there is a potential to have a huge saving, which can trickle downstream because we would be detecting early. Those patients are able to provide better care to them at the early stage, which in most cases would actually lead to better patient outcomes at much lower cost. The third area is digitalization, as it can really improve the efficiency in our healthcare processes. For example, improper triaging typically results in 20 to 30% more cost on the patients arriving in the emergency room because of the wrong diagnosis that was done. However, artificial intelligence based algorithms have enormous potential to take this error out of the triaging process and to direct them to right specialties at the arrival so that they can be properly treated and discharged in time. The second area which digitalization can help is providing AI aided clinical diagnostic support. So, for example, the radiologists who are reading the images and typically are spending long hours doing all sorts of reading all sorts of images can use today AI aided clinical diagnostic tools which can help them read simple images much faster, like a broken head, a broken hand, or a broken leg. And there, in a fraction of time, maybe even create an automated report. And the role of then the radiologist could be is to supervise, to check, and then approve. This helps in saving time and helps them in using that time to work on more complicated cases which require much more attention from a human perspective. And thereby, I believe these are three main areas where we can drive efficiencies, which have huge saving potential, and that those savings can then be deployed to create infrastructure, both human infrastructure and technology infrastructure, to better manage the chronically ill patients in the communities.